Hi friend, this is Dr. Apurv Mehra.
Hi, this is Dr. Shailesh Pai.
So we are going to talk about the Pinnacle course here, which is going to happen at the Vidya Jeevan Center at Greater Noida on 21st, 22nd and 23rd February 2025. Shailesh sir has drafted this course with the guidance of his seniors, with the support of his friends and the colleagues at Conceptual Orthopedics. And we are very happy to say that the response to the course is phenomenal. But here I'm going to specifically talk about two sessions which he has kept on the first day and the second one on the last day. Coming to the first session, sir, skill labs. I never had access to skill labs during my entire training. In fact, you took about 30 minutes to explain all of us what is skill labs and what all sets will be there. What I understand is there will be 8 stations of skill labs where our 72 young budding orthopedic surgeons will have an exposure to. So can you quickly tell us why have you included this in the Pinnacle course and that too on day 1?
Correct. So skill labs or advanced simulation training as we call it, it's a very important thing to learn in a different way of learning most of the practical things that we do in trauma. So the way actually we learn is by seeing what others are doing or maybe doing ourselves. But what if it is done in the right way? We can only interpret if we do it ourselves on a particular method and do it. Now, for example, like you just talked about 8 stations. The first station is torque measurement of screws. A common question which most students or budding orthopedic surgeons have is how to hold the screwdriver. 2 fingers, 3 fingers, the entire palm, and no one actually teaches us that, right? A statement can be made, there is no difference, you can hold it any way you want. It ultimately is the same thing that you are driving the screw in the shaft. But whether it really makes a difference or not, we can see it happening right in front of our eyes when we measure the torque if we use a particular method of using the screwdriver. So when we see that, we learn. Otherwise, it's just hearsay. So such similar station, now station 2 is how much penetration that can happen of a drill bit across the cortex. We all know that there are a lot of vital structures on the far end of the bone. It may be a nerve, it may be artery, it may be an important tendon, and we do not want our drill bits to go that far beyond the bone on the opposite cortex. But having said that, it's very difficult to control. Even an experienced senior surgeon will find it extremely difficult to exactly stop where he wants to stop. So in this particular station, we will see what's the difference when we use a sharp drill bit versus a blunt drill bit. Even if you want to stop, you will not be able to stop a blunt drill bit from piercing and going significantly inside.
So this is a subjective measurement or objective measurement?
This is a very objective measurement where a delegate does it. He sees for himself, all his friends will be seeing it. You can actually measure the depth of penetration on the opposite cortex. So this all learnings that happen over here, nothing is theoretical. You do, you learn, and this will stay in your mind forever.
Yeah, so like for example, you were telling the third is about the heat generation by the different ways.
Correct. So again, a very common method I may say across our country and many other countries also is that we tend to use a K wire to drill rather than a drill bit, because we all know the cost difference, right? A drill bit is pretty costly, it can break, whereas K wire is pretty cheap. And although the diameters are same, why not employ the same is the question we may ask ourselves, or we may be doing it without knowing the real difference between drill bit and K wire. Now I can theoretically tell K wire will generate heat, and you may think it is just temporary, it hardly takes 3 or 4 seconds to drill across a bone and come back. So what difference does it make? But when you see the heat being generated and compare it with a sharp drill bit or a blunt drill bit, you see it, how much heat is generated. I'm pretty sure after this session, no one will dare to use a K wire to drill a bone. So that is the learning. So these things will again reinforce our understandings by just seeing and doing and being able to appreciate the heat that is generated by a measurement.
So fantastic. So I'll just tell you the 8 stations that has built up, and each one of them has a principle. For example, the first one is about the torque for the screws. The second is about the soft tissue penetration, and we all know that orthopedic is just not a bone surgery. So handling of soft tissues are pretty important, and similar related is the heat generation. The fourth is about the nails. The fifth and the sixth station talks about the plates. The seventh talks about the plates along with the screw combination, and the last station talks about the entry points. I am very sure that this video, if we want to talk about each station, is going to be tough to complete. But what is important is when you come here, you will have about 90 minutes of these sessions here, each one of you will have a hands-on experience with the guidance of the teachers around you. So this is one session which is very, very precious and is different from any course which exists anywhere. And I'm really thankful that the entire team of Dr. Shailesh Pai, supported by different organizations, has come out with fantastic material to train you for getting a better version of you. Day 3, sir. I mentioned in my last video as well, one of the most difficult trauma surgery for me today is removal of implants.
Absolutely.
So just few words about what you have on the last day.
So we have this exclusive module on implant removal. Like just described, toughest surgery by far, if you ask any senior surgeon, experienced surgeon, is inability to remove a particular implant. It has never happened that we are not able to put in an implant, but it has happened so many times that we are not able to remove. Even the simplest of the implant removals can go horribly wrong, right? There are tools available exclusively for this surgery, and I'm pretty sure not many of us are aware of this. We may be knowing some of the tools, but we not know that there are different tools for screws, different tools for plates, different tools for nails, square nails, tense nails, each one of these. And the more thought-provoking process would be that there are engineers who design this. They have thought about few things and put those things in place so that an excellent tool comes out, right? So we have actually joined hands with a very important organization, which proud to say is an Indian organization. The chief of whom actually is an engineer, and he has his heart and mind at the right place. He can discuss with orthopedic surgeons, and he's brought out these amazing tools that are actually there, and they will demonstrate various modalities of problems that one faces and what the tools are available, and hence our knowledge will definitely improve that. We also could use those particular things and be prepared the next time when we are going in for a challenging case, which is the implant removal.
Right. So day 1, you will have teaching, case discussions, hands-on experiences, different sessions, along with skill labs. Then at the end, doubts by the students who will be sharing the cases to us. We'll be sharing the Google form with you very soon. Day 2, again, sessions along with whatever demos or procedures you want to perform. Day 3, which we just discussed, the specific agenda apart from the things that we are already covering is what went wrong, which is a session which everybody would love to know, because we as orthopedic surgeons love to know what others did wrong. And the second thing is, which we just discussed about the implant removal. One piece of advice for all of you, that till the time we don't meet, right, that if you have planned a function at your home, never take up an implant removal case on the same day and promise time to your family members, because you might be blamed for your life. So be careful on that. Thank you very much. Thank you, Dr. Shailesh, sir.
Thank you.
See you in Delhi on 21st, 22nd, 23rd February.